My name's Nima. I'm a medical ophthalmologist, so I deal with the eye in relation to full body diseases, and I trained in both ophthalmology and internal medicine. And I gave a talk on Oculomics, which is the way we can, from the eye, discover biomarkers which can be linked to systemic diseases and can help screen, prognosticate and diagnose full body diseases. Oculomics effectively is putting into one word the eye being a window not just to the soul but to our overall health. It's a very, very new field, so many people weren't aware of Oculomics, but it's something which is set to expand rapidly over the next couple of years, and a lot of the work, a lot of the research, a lot of the clinical validation is happening in this country, and I think it's something which could potentially be a game changer for how we approach the big diseases. Hopefully, over the next few years or decades, Oculomics may be able to revolutionize diagnostics by predicting systemic health conditions years or possibly decades in advance. And there'll be a pivotal role that both hospital and community optometrists will have in clinical applications and in future research. What's the most exciting for me are conditions which are really difficult to pick up in the preclinical stage, especially diseases like Alzheimer's disease, which affects over 1 million people in the United Kingdom. So being able to get insights not just from imaging, not just for retinal imaging, but also the proteins in tear films, functional oculomics, oculometrics, I think will be really important, because when there's no obvious way to do to get imaging of the brain and say you're likely to develop Alzheimer's, if we can predict the preclinical phase earlier on, it could be a potential game changer. The most desirable biomarkers are rapidly quantifiable and cost effective. We want to accurately detect the disease and identify risk factors and early signs of diseases using these biomarkers at a preclinical stage. We need to make sure that these kinds of technologies help narrow gaps in healthcare inequalities, not just within parts of the United Kingdom but around the world. Most Oculomics has concentrated on retinal imaging, and that obviously comes about because of the ubiquity of imaging and the large data sets we've accumulated around the world. In the UK, we're doing really well in terms of biobanks and giving data to feed Oculomics. We have the Insights Hub, part of Health Data Research UK, and that's become the world's largest ophthalmic bioresource, so almost 30 million retinal images and associated clinical data in that. The advancements in artificial intelligence enable us to, in combination, just generate insights that we wouldn't have otherwise been able to get with systemic disease. What we may see is discussion for creation of optometry-led oculomics in the high street, potentially in primary care, potentially in secondary care, where we get kind of oculomic profiles and predictions of systemic health risks for people who come and see you. So potentially exciting times are ahead, I hope, and these, I hope, will revolutionize the way we approach diseases, and eye care professionals of all different types may have a pivotal role in screening, in prognostication, and in multidisciplinary management, hopefully to give us a simpler, a quicker, and a less invasive way of predicting whether someone might get a serious condition